Okay, we're back. So we had just been talking about the blood flow to the heart. And as part of our blood flow from the heart to the heart, back to the heart, and we were talking about capillary exchange. And we had said at the arterial end of the capillary, you still have some blood pressure. And this is what pushes the filtrate, the liquids, the fluids, out into the interstitial spaces, the tissue spaces. And then we had said what brings back the fluid is osmosis. But what's sort of implied in all of this is that we no longer have blood pressure. And we don't. There is no blood pressure to push the blood back to the heart. So the question is what I've written up here on the board, what forces drive blood through the venules and veins back to the heart? And it ends up that there's another structure that is present in veins and venules that isn't present in arteries and arterioles, and those are one-way valves. Veins and venules have one-way valves in them, and the blood is only allowed to flow towards the heart. And what happens is when you breathe, when you move your muscles, whenever you're wiggling around doing stuff, your muscles are contracting and they're putting pressure on your veins. And if you look at your veins, I don't know that I can do it one-handed, but you can sort of close off a vein and then use your other finger to push along it towards your heart, and that is actually moving blood to my heart. I was like, oh wow, I got a hit of blood then, just by doing that. But anytime you move, muscle contractions, breathing, all of that is pushing on the artery, or I'm sorry, the veins and venules, and this pressure causes the blood to move, and it can only go one direction. That's towards your heart. Okay, so if we have this situation where the return flow is completely independent from the pressure that is produced by the contracting of your heart, you can have a situation where the return flow is greater than the pumping. And that happens after a heart attack sometimes. So if a person has a heart attack and they have damage to their heart, so it's not pumping properly because of scar tissue, what happens is the return flow is just like always. There's no change to return flow. And so the return flow brings blood back to the heart when the blood is not being pumped efficiently from the heart, and that will produce a condition called high central venous pressure. And so you end up with blood backing up into the superior vena cava and the inferior vena cava, and you have pressure on your right atrium. That's where blood, of course, is being returned to your heart. Now, where is the blood at any given time in this system? You know, we have arteries, arterioles, capillaries, venules, and veins. Most of the blood, as you can see on the slide, hopefully you're looking at the PowerPoints, most of the blood is in veins. At any given time, most of the blood is found in the veins. What else do I want to talk about in this section? Blood pressure, we have a slide that deals with blood pressure, peripheral resistance, that's that constriction of those smooth muscles around the arteries. We had said the blood pressure varies in the artery, arterial blood pressure varies with the contraction of the ventricles. So we have the systolic pressure and the diastolic pressure. The differences, the pulse pressure is the difference between the systolic number and the diastolic number. Hypertension is when your blood pressure is above 140/90, and hypotension is when you have low blood pressure. All right, so the rest of this section, there's some stuff that I don't lecture on, right? So I have some discussion of the pulmonary circuit. This is going to be the blood flow to the lungs and back. That's something that that you should know about. You need to know about the branches of the arteries that come off the top of the heart. So again, we have this diagram here. I guess it's slide number 12, major blood vessels of the heart. Make sure you know that. We have blood flow to the brain. This is the circle of Willis. And of course, I was going to talk about this in lab, but what can I say? Circle of Willis, what you have is you have arteries coming up to your brain. And rather than going just directly to the various parts of your brain, they feed into a circle of arteries. And this is called the circle of Willis. And so if you get a blockage in the blood that is feeding up into your brain, and this is through the basilar artery coming up your spine, next to your spinal cord, and your carotid arteries going up to your brain, you have this circle of arteries that's providing blood to all parts of your brain. We also have an unusual blood flow where you have a second set of capillaries. When we have that, this will be the slide number 14, and this is going to be what we call a portal circulation. So after the blood is picked up, after the blood picks up nutrients from your digestive